day to you. It's good morning for some of us and good afternoon for some. I would like to welcome you all here. My name is Khaled Chalan. I'm Elsevier customer consultant for core research solutions for Africa. And I would like to welcome also my colleague, Chief Unsi, who's the account development manager for Elsevier clinical solutions in Africa. I'd like to welcome you all here for this session where we are going to introduce you to Elsevier evidence-based solutions for managing the COVID-19 pandemic. Our workshop is going to be of value to all healthcare practitioners, all health policy professionals, as well as all the researchers working on COVID-19 related research. That's just so as to start. I'm gonna start a little bit with a quick introduction to the current pandemic and what Elsevier is doing to support the entire research and the health industry, as well as the governments working and fighting COVID-19. We'll be talking a bit on the literature discovery and how to keep up to date with the most recent literature that's being published around the clock. A lot of research, a lot of papers has been, a lot of ideas has been introduced to fight COVID-19, to try to grasp and understand it better. It is our common enemy, all of us, and we are here to help you keep up to date with all the huge influx of literature related to it. We'll be diving deep with my colleague Sharif for the clinical resources, the guidelines, the clinical trials, the drugs, and a lot of toolkits that will be of great concern to physicians and other healthcare professionals as well, working on the front lines against the COVID-19. At the end of the session, we'll be taking some of your questions and answers as much as the time allows us to. And we will be establishing how we could stay connected together and how we could follow up on all of your inquiries and questions later on. Just a few house rules. Please direct all your questions related to the matter being presented to the Q&A button on your Zoom website or Zoom software if you're using, whether you're on browser or you're using the application or the desktop software. We will also be discussing, so if there is at any time there is any quick comment that you need to put, you can use the chat as well. But we'll be monitoring closely the Q&A. We will try to answer as much as we can of the questions you leave us on the Q&A. So without further ado, as a quick introduction, so once again, the recent events that as I'd like to welcome you all here again. So as just a quick introduction to what we are discussing now is that the recent events have shown us again how rapidly a new disease can take root, and just like an immune response, the entire research community has been working over the clock to produce much research to fight this pandemic ever since it started. Ever since the disease outbreak started in China. And the thing is, with this explosion of the clinical and epidemiological information, it's getting a little bit of challenging to keep up with all the huge influx of information, especially with a lot of non-evidence-based information being highlighted, or even evidence-based resources being highlighted wrongfully sometimes in the media, and causing some confusions as well. So at Elsevier, it's our role as a publisher and as well as an information analytics business to actually help you and provide you with whatever resources that we can provide you to keep up with both the content and the information, as well as how to manage this influx of information and how we can help you organize it as well. A little bit of a background of Elsevier. It's one of the oldest names in academic publishing, and Elsevier currently publishes around 18% of all the research being published globally. It's not just the quantity of the research being the largest STM publisher or science, technical, and medicine publisher. It is also the fact that our publications have very high quality, achieving over 26% of the citations. But then again, we are no longer just a publisher. We are working to develop technologies that help you manage all the information and to analyze all the information that's being produced, not only by Elsevier, but by other publishers and maybe the entire academic community with some of our solutions. It is our role to be here to support researchers, to support healthcare professionals as well. Just as a quick note, so we will be introducing, as a response from Elsevier to the COVID pandemic, we have decided to make all our content available for free access during this pandemic. So all of you will have access to the content we will be discussing here. We will have access to some of the solutions. And if there is anything more that you would need from us, we will be telling you how you could actually reach out to us and get access to anything further that you would need as well. We are all in this together. I know it's a very difficult time. Many of us are working from home globally, and we have our healthcare professionals working on the front lines, our researchers working over the clock. It is a difficult time for all of us, and we're here to try to do our share and to actually support you in all of your fighting against this pandemic. So we'll be discussing a few things. So we'll be discussing the resources available by all Elsevier publishing. We will be diving a bit into some of Elsevier very specialized and very prestigious medical journals like the Lancet and Cell Press and Biomedical Research, as well as some of our partners like the American College of Cardiology, journal JACC, and Chest Journal as well. We'll be giving you some of the information on the clinical, on the COVID clinical overview for the COVID-19. We will be talking about the nursing as well as all care plan guides and all the other healthcare professions as well. The presentation I'm going to be presenting you will have a lot of links to our resources and our information center. By the end of this webinar, I'll be sharing with you this presentation, as well as the certificates for attending this workshop today. So without further ado, we'll be discussing startingly. So everything that we have on COVID-19 is organized into just one web page. It's the COVID-19 directory, and it is organized, all our resources, all our content is organized into different audience or different people who are fighting the COVID. So there is a portal, or there is a directory with a subsection for the healthcare providers, for the academic researchers, for the health educators and the health and students. And also we do not need to forget the R&D professionals and the engineers working on developing the technologies, or just make do solutions with the current solutions that we have to overcome the shortages we're fighting. We have a special portal set up for librarians. So then again, librarians as well as the publishers are there to support you with providing the information that you would need to. Also, we have a portal set up for media to be able to get their facts on the latest evidence-based research, as well as any follow-up needed as well. So the link you have here, this is a direct link to our coronavirus resource directory. We've also organized our content into an information center format. So this is curated and updated continuously. It's a single web page that's overflowing, and you can get updates and list articles, and it's curated and posted on day-to-day basis. You'll have latest information on the clinical information, on the public health aspects, patient resources, research and drug discovery, and there is a special section in Chinese. So this Coronavirus Information Center started last January. The screenshot you see here might be a bit old, so the last update we have for this information center is actually this week when we try to visit it together. And you have the shortened link again down there to be able to reach this information center. So it's an information center. There is a constant feed of new information. All the important information that we have is being highlighted on this COVID-19 info center, and I would strongly advise you to have this as one of your starting points just to keep up to date with what's going on. Next, I'll be sharing with you some of the content and featuring some of the content that we have fighting COVID-19. So basically, everything Elsevier publishes lies on one website, Science Direct. On normal days, around more than 20% of the content that is published by Elsevier is open access and it's freely accessible for everyone. However, anything that we have that is related to the COVID-19 or coronaviruses in general, including all research being done on previous disease or any related disease related to the COVID-19, is freely accessible to you. There is more than 27,000 articles and book chapters available on Science Direct. You can find a search with all those articles that Elsevier produces for fighting COVID-19 available on the link you can see on screen. So basically clicking on this link will take you to Science Direct, and it's a preset search query that is continuously updated. So maybe by the next time we will be having one of those sessions or introducing these resources, actually the numbers are going up. Our publishing team and the researchers and the reviewers, they are working over the clock to keep you up to date with the latest of what's happening, whether these are research papers or case reports or correspondence or comments that researchers have. It's an ongoing discussion where everybody's contributing. If you want to stay up to date with this, with all the latest research being published and receive periodical emails on everything that Elsevier is publishing related to it, what you would need to do is just to register or sign in to Science Direct. We strongly advise you to use your institutional emails if you have them on Science Direct. Your institution could have access to some of the Elsevier's publishing, and also you might already have access to some of the solutions that could help you along the way. So it's always recommended to actually use your institution email on Science Direct, but then again, these are all the articles on COVID-19 are available for everyone, at least as long as this pandemic goes. What you will need to do is to then click on the set search alert. What this will do is that periodically you'll be receiving email whenever there is any new publication that comes up that covers or relates to the COVID-19 pandemic or the coronavirus research that's being done. So a little bit, let's dive and get some statistics on what's being published by Elsevier on the COVID-19. So this is a little bit of a breakdown for the search results, and as you can see, there are publications that go as far as 2000 and even back in even years before that. So any research that could help in any way, if it's done on any sort of coronavirus, any coronavirus, any virus of the coronavirus family, or any disease that was caused by any of the coronaviruses like MERS or SARS or any other as well, you will find them available as well. You can see the breakdown of the article types. You can see on the screen, there are a lot of review articles because these are all the historic data that we have on any research that could be related, as well as the journals these are published in. If we just, if we only restrict this to the research that has been produced since the start of the pandemic, so all the research that's being published since 2020, And also there are some research that's being scheduled to be published even in 20 and 21, and it's also still accessible. So as you can see here, so our premier medical journal, The Lancet, has been most active within Elsevier journal, publishing research on the COVID-19, and there's also the Lancet Infectious Disease. Once again, all the articles that are mentioned in this breakdown are freely accessible to you. You can find them and discover them together. There are also other journals that have a lot of resources that will be related to the COVID-19. And the thing is, since the Lancet is our flagship journal on medicine, as well as Cell Press, these are our premier journals on biology-related matters and biomedical research, we have established info centers for these prestigious families of journals where all the content is available and it's curated, and you get the highlights and as well as what are the most important research, what's the most read research, and all of the resources that you would need from these journals as well for the current pandemic. So moving forward, it's not just the journals, it's also the books. So these are just few examples of the books that might be very relevant to you. So there is books on, so there is the textbook of respiratory medicine, the chapters on mechanical ventilation and non-invasive ventilation, for example. There is the non-applied respiratory physiology book, and the chapters on respiratory support and artificial ventilation. These are just few examples of some of the books that we thought that would be very relevant to the majority of the healthcare professionals working against the COVID-19. There is also other books that are related to the public health aspects and how the control of infectious disease. And some of them are published just this year, highlighting what happened in Wuhan, in China, when the outbreak started. So this is just few examples that I'm highlighting to you. All the links that you will find on the presentation are clickable and can lead you directly to these resources all at once. Just to move forward, so also all of our textbook content in all fields, so this is not just related to COVID-19. If you are a university professor, or other university professors or students who are studying from home right now, all of our textbooks have been added to all current subscriptions of Science Direct. So if your institution is one of Science Direct partners, we have made the textbooks accessible and free for all our existing partner universities. What you will need to do is just click on this link or sign into Science Direct and just use your institutional email. This is once again why I'm telling you that it's always preferable to use your institutional email. You can also find on the previous link the list of the textbooks in all fields. This is not just COVID-19 that will be accessible as part of our response. So next, as I said a bit earlier, so the Lancet group of journals, they have been spearheading all of our content on the COVID-19 pandemic, and we have established a dedicated page for all the content coming from the Lancet to be curated and continuously updated with highlights, with materials that you will need to do, that you will need to follow on this COVID-19. As you can see, so it's as far as the community or the academic and the health community response to the COVID-19, it's not just the aspects, the direct aspects of the COVID-19 disease, it's also you will find even research being done on different aspects, different medical aspects related to COVID-19, even including psychiatry. There are always research that's always being curated. And you'll find also some multimedia like audio recorded by the authors, or videos highlighting some of the content that's being published throughout the Lancet journals. On this resource center, you will find that you can register to receive email updates. So the one difference is you will be receiving not just notification of new papers, you will also be included in all the other materials or the multimedia that are being curated and updated by the Lancet team as well. So it's the idea of creating these alerts that and managing them. You don't want to overload yourself with alerts. So just pick out to have few emails sent to you, for example, on weekly basis that will keep you up to date, that will keep you following through with all the new content and the new research being published on the COVID-19 pandemic. So, so you can see also the Lancet coronavirus or COVID-19 information center actually includes the most read articles. So you will find, and actually the currently most read article on the Lancet was related to the clinical trials on Remdesivir. It was not the most encouraging results, but it was very full of insights that we hope will help us on finding a cure, whether it's a vaccine or an antiviral drug or others that actually can help us slow down the pace of the pandemic and effectively fight it better. There is one of our most popular editorials is on Brazil. All our hearts and prayers go to the people of Brazil as the disease sharply outbreaks there. And also, you can also find other articles and correspondence as well. So one thing that you would need to know is the difference between an article and the correspondence. I'm sure that the majority of you already know. So an article is a peer-reviewed research paper that has gone through the meticulous peer review process. A correspondence is a quick findings being sent to the journal. They are usually not peer-reviewed. They are just reviewed by the editors and published due to the urgent nature of the findings that were found through this in this correspondence or the letter sent to the editor. So yeah, to move forward, also one of the papers that are very popular on the Lancet as well, it's actually describing the experience being done in Wuhan in China so this is a little bit of a public health or a public health management related a bit, how they handled not to have their healthcare system in Wuhan completely saturated with cases, and how they actually could flatten the curve in Wuhan. So it's how it's called how the Fangang shelter hospitals for the COVID-19, they've had a very interesting approach to as a response by the hospitals there. There is also a video for the principal investigator on this research who was actually explaining what they did do on in Fangang shelter hospitals. So you can find the link for the video as well as the a link for the paper itself. I believe it's a very influential paper full of insights. We hope that we don't have this kind of very sharp outbreaks in Africa, but it's always useful to always be prepared as well. Next is, so these are some of the journals being published by Elsevier and on behalf of our partner societies. So the American College of Cardiology publishes its leading JAC, the Journal of the American College of Cardiology, in partnership with Elsevier. They have set up also a landing page for all the resources on COVID-19. So if you are a cardiologist, you will find a lot of resources very specific to the cardiologists working with the COVID-19. So you can find it on the shortened link on the screen, and they've also created a hub with all the materials, different materials. So there's one related to the journal and one related to the entire college. Also, we strongly recommend that if you have any interesting case reports that are related to COVID-19, there is an open call for case reports on the JAC case reports. The deadline is June 1st. This is one of the most prestigious journals on cardiology. There is also a recent webinar that was held by the American College of Cardiology in liaison with the Chinese Cardiovascular Association on the COVID-19. It's a very interesting, very insightful webinar. You can actually learn the discussion between Chinese cardiologists who just got through the first wave of COVID-19 and the US cardiologists who were actually on the start of the rising or the outbreak for the pandemic in the US. So it dates back to in April when things were still picking up pace in the US. Also, the American College of Chest Physicians publishes their leading chest journal in partnership with Elsevier, and they have set up a resource page with all the content that of interest to intensive care health professionals, ICU healthcare professionals, as well as some of the guidelines, some of their most recent research, as well guidelines and protocols related to chest. It's available on the link that you can see on screen, and there are different kind of guidelines and information available. So whether there is a recommendation for managing the or how to handle the protective equipment, the PPE, the personal protective equipment, or whether these are infographics on some of the aspects that are related to chest really with the COVID-19. So like ARDS, for example, and many others available on their resource center. Next, this is a little bit for people working on the basic science aspects or the biological aspects of the COVID-19. Our premier biomedical and biology research group of journals, Cell Press. So you will find a lot of research if you are a virologist, for example, or if you are working on the molecular pathways, for example, or how the or if you are working on the a little bit on the biological aspects, and so the focus here will be on the SARS-CoV-2, most of the journals, as well as anything related to the COVID-19. You will find you can also receive updates from the Cell Press on their landing page. There are a lot of studies on the related to molecular biology, related to the pathways, related to how the virus actually interacts with the cell in different aspects, starting from infection to replication and across the cycle as well. These are available on the Cell Press content. You can find, so these are a few content from Cell Press that I'm sharing with you. There is a snapshot on the COVID-19 and the viral structure and its life cycle, the immune response, and clinical course as well. There are research that's being done that studies actually from molecular biology perspective, some of the antiviral drugs like lopinavir or ritonavir, for example. So MED is MED is a very special journal, as you can see the article from the third one here. So MED is a journal that is said to be a bridge between biology and medicine and translational medicine as well. In addition to a lot of the research being done on how the COVID-19 interacts with the cell, as discussed a bit earlier. There's also, we're sharing with you, these are some of the links to the content from other publishers. So this is not Elsevier content. So whether it's other publishers like Springer Nature, Wiley, New England Journal of Medicine, BMJ, and many others. These are all clickable links that are going to be in the PDF that you will have access to by the end of this webinar as well. Next, a lot of you has been following up on very interesting research that has been accessible as what we call a preprint or an early stage research. Just as a recap on the definition, a preprint or an early stage research, this is research that has not yet been peer reviewed This is the research. Early stage research usually refers to two sets of publications, whether it's a preprint. So this is a research paper that has been submitted, but it has not yet been or well as paper where that's a research that is still in progress, that's still being developed by the researcher. They are sharing their findings as they go, and they are working on their paper, but they have decided to keep a draft available online. Once that research paper has been submitted, it's usually referred to as a preprint. When it's accepted, it becomes what we call an accepted manuscript, then a finally published article by the end. There are a lot of research, so given the current urgency, I would strongly recommend that you keep a tab on the early stage research that's being done on COVID-19. SSRN is Elsevier's solution for it's a free solution for researchers to upload and to share their early findings as working papers, preprints, as well as their finally published articles if they are open access. So everything on SSRN is free to upload and free to read and free to download as well. But what we have added here is that we've created a landing page that gathers all the research that's being done related to COVID-19. And the idea is you will be able to see that all different aspects and all different fields of research that is related to COVID-19. So there's going to be a lot of medical papers there, a lot of health sciences papers, a lot of life sciences and pharmaceutical papers or pharmacological papers, as well as papers studying the social science aspects of COVID-19 as well. Whether it's related to economy, to the effect on industry, to effects on business, effects on psychology, for example, it's all lies in one place as well. We've had a very successful experience with SSRN being very influential with the Zika virus outbreak and the most recent Ebola virus outbreak as well. We've seen that a lot of researchers resorted to keeping up the tab on the very early stage research available on SSRN. As you can see, so the content on the SSRN landing page for coronavirus, the one with the link available on the previous slide, it's organized into the COVID-19 related research, infectious disease research beyond COVID-19, so it includes also other coronavirus-related disease like SARS or MERS, as well as other infectious disease like Ebola, Zika, and others. Interdisciplinary coronavirus and infectious disease-related research. These are the aspects related to public health, legal, economic, business, fiscal, and others as well as other resources. Once again, the new part here, SSRN, is a freely accessible website for research by Elsevier. It's free to upload and free to read. What we are adding here is that we are trying to curate, so to select which preprints, which working papers should be highlighted and should be gathered in one place for you to follow up on the most, to just be even ahead of the curve when it comes to the most recent research being done. So as I described again, the difference between the preprints and the working paper. Preprint means that it was already submitted to one of the journals. You can see here some of the preprints are already been submitted, for example, to the Lancet, as you can see on the left hand of the screen. On the right hand of the screen, you can see working papers. These are still being developed. They haven't been submitted yet, but you can see that there are people downloading and reading this research. They are interested to get a sneak peek, if I might say, on what's going to be published next as well. Last not least, before I hand over to my colleague Shif, I also, if you are working on pharma, if you are doing R&D related to pharmacological research, we have a portal for all the resources that we have for COVID-19. As you can see on the screen here, there are a lot of recent information that's being available. We have a lot of solutions that can help with the drug discovery, with the development of a cure for the current pandemic. You can see here, this is one of the highlighted analyses that were done on chloroquines as inhibitors for ARDS. The resource, one of our solution captures the most recent clinical trial data and curates them into one place. If you need access to this kind of information, please send an email to covid19@elsevier.com, and we'll be discussing that there is one single portal where you can get access to anything other than the content that you actually need from Elsevier, all of our solutions as well. If you are working on COVID-19 related research, please reach out to us. Please get access. We have solutions that can help you actually on this, especially if you're working with drug discovery or if you are working with clinical research on the COVID-19. There is also a list generated by, so one of our solutions, Elsevier's Pathway Studio, was actually done to test 121 drugs and natural products as an example for SARS. It can help you with this kind of analysis as well. Last not least, if you are working on a research on COVID-19 or in general, so Mendeley has a portal for research funding. You can always look for funding opportunities for all kinds of research, but if you are working on COVID-19, if you go to mendeley.com, log into with your account, and you can actually search for all related opportunities that are related to COVID-19. There is a lot of funding opportunities, and they are increasing over the hour for people working on this kind of research. Mendeley is a freely accessible website, and as well as a reference manager that you can actually it helps people in academia to manage their references while they're writing, as well as network together, in addition to exploring data sets, careers, and funding as well. So by this, I will have concluded my part of the presentation today. I leave over to my colleague, Sharif Unsi, who will be taking over from here. Please, if you have any kind of question, please leave your questions in Q&A. I'll be moderating the Q&A while Sharif is presenting. All the questions I answer will be available for everyone to read as well. So please direct all the questions you have to the Q&A. Thank you so much.
Thank you, Khalid. Hello, everyone, and welcome. My name is Sharif Unsi, and Account Development Manager for Middle East and Africa related to the clinical solutions. We're going to show you today how to reach the latest articles, guidelines, and clinical trials, and of course, drugs and toolkit site, among other articles that you can reach through a lot of clinical solutions will be provided in this session. So just giving you a brief about the clinical solutions portfolio. This is our solutions, reference and decision support. The first one, which is clinical key for nursing, clinical pharmacology for pathologist, immunoquery for immunologist, and StatDX for radiologist. Then comes a clinical practice, which is care planning and order sets for hospitals, academic education certification path primer, RAP primer for pathologists, education of pathologists, education of radiologists, clinical key student, which is the curriculum of medicine from the 1st to the 4th year, and in an interactive way with from the educator to the students, so that each educator can assess each student performance, and based on the student's performance, the educator can send him or her questions to improve their performance. Then comes the complete anatomy, which is the latest acquired from 3D4Medical, which is an anatomy application that will support the students in subject of anatomy. Then comes patient engagement, interactive patient education, learning competency management, clinical skills, and clinical e-learning. And the last part, which is the professional practice service, which is the workflow optimization, implementation service and training, interprofessional practice advancement. Then these who we support. We support, as Elsevier serves numerous healthcare professionals to integrate evidence-based content into care process and help improve patient outcomes. Related to the health executives, we're gonna show you here the care planning and professional practice service integrated care plans directly into your EHR. Order sets quickly translate knowledge into actionable orders for physicians. Interactive patient education, educate your patients by sharing interactive information wherever they are in format, language, and health literacy level that learn best. This is related to partnering with health executives. Then comes the physicians part, which is one of them is Clinical Key, and I'll show you a live demo about Clinical Key. Is a clinical search engine that thinks and works the way you do, making it easier to find and apply relevant knowledge. Then comes StatDX for radiology, developed by renewed radiologists in each specialty. StatDX provides comprehensive decision support you can rely on. Then Expert Path for pathologists, over 4,000 topics and more than 51,000 expert selected images for quick answers for today's challenges. And the last for physicians is Clinical Path, formerly was via oncology, improving outcomes for patient with care. So it's mainly focusing mainly used by oncologists. Then comes the third is nurses, Clinical Skills, a comprehensive online solution that enables organizations to standardize and educate and manage competency among their nurses, therapies, and other health professionals. The last part for nurses, which is Clinical Key for nursing. It's the same as Clinical Key, but mainly focusing on nursing content and other tools available for nursing. And the last part is the pharmacist, which is Clinical Pharmacology powered by Clinical Key, delivered the fast, smart, and safest medication decisions. I wanted to share with you this because when we open the toolkit, all of these solutions, whatever is available related to the COVID-19 will be available as open access. So just wanted to brief you what we're going to see in the toolkit site to show you what's the objective of the toolkit and how to support with evidence-based medicine related to the COVID-19. These are the open access links. I'm just adding it to the presentation so that everyone can reach them. The first one, which was even my colleague Khalid discussed it, which is Information Center, Coronavirus Information Center. Then comes the Elsevier Toolkit, which is the Healthcare Hub, the second one. And the last one is the Resource Center that you'll find videos available to show you how to navigate and search Clinical Key for COVID-19. So if you're a subscriber to Clinical Key, you'll find the last link even very useful for the users in your account. So let me show you how to reach the Healthcare Hub. So all you need to do, if you're not a subscriber on any of Elsevier solutions, you can just type elsevier.com. And at that point, you'll open the homepage of Elsevier. Please select Product and Solutions and select Clinical Solutions. Then it will open the homepage of the Clinical Solutions, giving you a brief about every single product. But what I wanted to share with you is the Healthcare Hub. So please visit the hub here. When you select it, it will open a new tab for the Healthcare Hub that we're going to discuss today. So the Healthcare Hub here, as you can see from the navigation bar at the bottom of the page, you'll find here the toolkits itself. You'll find the refresher, daily rounds, expert insights, COVID-19 guidelines, and the last part is research resources. Let's start first with the refresher. So a refresher toolkit you'll find here mainly for nursing and respiratory therapy, physicians, and pharmacists. So if I'm a nurse, I'm going to select this one, and it will show me here infection control and prevention. These are from clinical skills. So there's the skill itself. It's listed here with its checklist. So for example, I want to check the isolation precautions. Here it is, Elsevier clinical skills for pediatric, an alert message, the overview about the skill, the educational part, assessment and preparations, isolation precautions still yet, procedure itself, all of the steps starting from the hand hygiene till the documentation in the patient records. And of course, at the bottom of the page, you'll find the references at the end. Also, if you're interested to download the checklist, of course, all of this is downloadable. that you can share with any of your colleagues, even if they are not any of Elsevier subscribers. So you can download it and you can print it, of course. Then let's go back to the toolkit, to the healthcare hub, I mean. Here's the skill that we checked. If I want to check the checklist, I can select the checklist. As you can see here, isolation precaution, the same for pediatrics. Satisfactory, unsatisfactory, or not performed, and commence. And here, starting from the step of performing hand hygiene till the last step, you'll find documentation in the patient record. The procedure in the patient record, and of course, the learner signature, the evaluator signature, and the date of proceeding or doing this skill. Let's go back again to the toolkit. So this is a way to check everything on the nursing refresher. So starting from infection control and prevention, then you'll find assessment, specimen collection, lab interpretations, oxygen, mechanical ventilation, mental status, and mental health. So all of this is related to nursing. So if I want to check here directly respiratory therapists, home health care, it will take me directly as this is the navigation bar. So if I want to go back again to check, for example, if I'm a physician, I'm gonna go back here. Sorry. Here's the refresher. I'm a physician. I want to check what's there for the refreshers for a physician. What to know. You'll find it here. The clinical overview for the COVID-19. Let me give you a quick brief about it. Here is the clinical overview obtained from Clinical Key. So the terminology of the coronavirus, clinical clarification, the classifications, the diagnosis itself with the clinical presentation of the patient's history, cases, causes and risk factors, diagnostic procedures, differential diagnosis, influenza, other viral pneumonias, bacterial pneumonia, treatment, goals and dispositions, treatment options, and so on, drug therapy, and so on. So this will also be available if you want to download it and print it. All of the content I'm sharing now, you can share it or download it whenever you want to. So as a physician now, what else is the refresher? You'll find clinical overviews, for example, that we check the COVID-19, acute respiratory distress, sepsis, community-acquired pneumonia. You'll find other books, chapters available that you can download, obtained also from Clinical Key. Any chapter you want to check, you can open it and download it. The procedure videos, what to do. We're in the tab here of what to do. Procedure videos, so you'll find videos here available for physicians related to whatever here is for COVID-19. So for example, arterial line placement, I want to check this one. It will open a video.
An intra-arterial catheter is placed in a normal Allen test. Also, radial artery cannulation has been performed without complications in patients whose Allen test.
And this is just giving you a brief about the refresher. So if I want to go back again. If I'm a pharmacist, also I'll find a lot of useful tools here. This is from the refresher. What's in the daily rounds? You'll find here COVID-19 information evolves constantly on daily rounds. We're sharing information our team found interesting or impactful. So you can check here whatever is related, for example, for health centers for disease control and prevention. So all of this content you can easily find applicable that you can download and check. Then comes the expert insights. So this is an interview with experts related to very interesting topics that you can listen to, and you can check what's always updated on daily basis. If there's any updates, you'll find it here. Then comes the COVID-19 guidelines. You'll find also guidelines available here related, for example, from the WHO, European Center for Disease Prevention and Control, China National Health Commission, Italian Thoracic Society, and so on. Then research resources, health organizations for WHO, Chinese Center for Disease Control, European Center for Disease Prevention and Control, US Centers for Disease Control, Elsevier resources. So all of Elsevier resources, you'll find it from here. Community Coronavirus Information Center, Coronavirus Research Hub, The Lancet, as my colleague was discussing, Khaled was just discussing, LexisNexis Risk COVID-19 Data Resources, Cell Press, Science Direct Coronavirus, and also from other publishers. You'll find all the content available from for their hubs available here. So this is related to all what's in Healthcare Hub. We didn't yet discuss the toolkit. Let me show you the toolkit. Here we go. So the toolkits you'll find here related to community care, ambulatory care, emergency care, inpatient, ICU, and the last one is mental and behavioral health. So for example, I want to check the community care. You'll find here the navigation bar, what to know. This is the clinical overview for the COVID-19 that I just shared with you. What to do for the nursing skills from clinical skills. So you'll find the skill itself plus the checklist of the skill. Order sets. So if I want to check, for example, the COVID-19 testing module, you'll find it here. The laboratory testing of COVID-19, pharyngeal swab, and this is how to test for COVID-19. The links you'll find also external links that are shared on the Healthcare Hub. Then comes what to say for the patient. So you'll find a lot of patient education handouts that doesn't contain any medical terms. So this is mainly focusing on what the patient will understand and learn more about his or her disease. So I want to check, for example, cough in adult. Here it is. What are the causes of coughing? Follow these instructions at home. Medicines, lifestyle, general instructions for coughing. Contact a healthcare provider in case of, get help right away in case of emergency. The summary itself of the handout. And of course, all of them are the same page setup. So whatever you're looking for, you'll find them the same way. Then comes, you'll find also, if I want to check what else is available, the ambulatory. So I want to just check the community. I want to check the ambulatory now. The same way, what to know, what to do also with the nursing skills related to the ambulatory patients. Order sets again. What to say. Of course, it's different than each patient status. So community is different than ambulatory. So you'll find whatever is related to your patient available here. Then you'll find also sometimes videos educational for patients. So for example, if I want to check pneumonia video, I can even share it with any of my patients or send it to my patients so that this will support the telemedicine, not to trying to reduce the contact with other patients. So this will be very useful. Then let's check also what is available here. You'll find here emergency, clinical overview and drug monographs, COVID-19 drug therapy, azithromycin, chloroquine. Let me show you one of them. So I checked, for example, the drug monograph for hydroxychloroquine. What will be available here? The indication and dosage, the labeled and off-label indication, oral dosage, suppression of polymorphous light eruption, therapeutic drug monitoring, inpatient, outpatient use, maximum dosage limits, and so on. So whatever is related to a drug, you'll find it available here with its reference always written beneath it. So what else is available? The e-learning, but it's a long presentation, diagnostic image. This is obtained from StatDX, and you'll find also a few links from ExpertPath. ABM, evidence-based medicine calculator, drug information, IV drug administration, for example. Let me check this one. So for example, the ampicillin drug, the dosage, antimicrobial diluents, dilute volume, administration rate, and so on. IV push administration of drugs. So whatever is related to the medicine for the IV, you'll find it here available with the dosage. Nursing and allied healthcare plans. So this is for nursing care plans. For example, fever and pediatric. Clinical description, key information, threats of life, limb or function, clinical goals, correlate health status, the presentation, signs and symptoms, potential causes, initial assessment, and so on. So this is care planning. Then comes the nursing skills, as we mentioned previously from clinical skills, with the skill itself and its checklist, order sets, procedure videos for physicians and nurses, external links, and then what to say mainly for the patient. So patient education handouts again, and also other videos available for educational for the patient education. And then we're not going to go through every single part of them, but just to show you that there is also inpatient, ICU, and mental health. So these are what's available from all clinical solutions for the COVID-19 are provided in the Healthcare Hub as an open access that everyone can download and share all of this content to support every healthcare professional in taking his or her decision when it comes to our COVID-19 patients. Let's go back again. And if you're a subscriber to Clinical Key, let me share with you how to check Clinical Key for the latest articles and guidelines also for COVID-19. So all you need to do is type clinicalkey.com from your institution. And I'm going to type here coronavirus. There's a smart search functionality that guides me even if I want to. I'm going to stay with coronavirus only. So there is 8,121 results from Clinical Key. So I'm interested only in journal articles. I'm going to select or specify my source type from the filters on the left side of the page. Here are the journal articles related to the coronavirus. Anything I want to check here, the type of article, for example, I want only my type of articles to be narrative review, for example. So the number went down from 8,000 to 4,000 to being specific for narrative review, 678. So for example, I want to check, let's check, for example, Journal of Autoimmunity. Full text article as usual, you'll find them all full text article. And here are the author's name. Here is the journal name. If you want to subscribe for alerts for this journal, you can subscribe. And also you don't need to read the whole article. If I want to go directly, for example, to comorbidities, it will take me directly to this part. And also, if I want to download the article, and also if I registered on Clinical Key from my institution, I can download and I can save the article, and even I can email the article or share it with anyone who might be interested. And even I can print the article to read it further later on. Let's go back to results. So I want to check, for example, the guidelines, how to check for guidelines on Clinical Key. I type my search word, the coronavirus, and I want to check, for example, the guidelines. Here are they. There are 12 guidelines. I can check, for example, full text article. Here are all the guidelines available. This is an external guideline from the WHO. So if I want to check it, clinical management of severe acute respiratory infection when novel coronavirus infection is suspected. So I'm going to press the hyperlink. It will open the site of the authoring organization that released this guideline. So here it is. If I want to download it, of course, or if I want to print it, it's up to me to use it whenever I want to. And back to results. If I want to check, for example, the clinical trials related to the COVID-19, here are all the clinical trials. If I want to be specific, I want to read further about this clinical trial, I can open it. And then I'll find here the purpose, the eligibility, contacts and locations, more information. And from more information, you'll find here the link to clinicaltrials.gov database. If I select this link, it will open here the study details with the design itself and description, the outcome measures, arms and interventions, outcome measures, eligibility criteria of this trial, contacts and locations, and so on. So if I want to read further, I just select the clinical trial of my interest and scroll down to more information and select the link. It will show me all what's necessary for this clinical trial that I need to know. Back to results, clear all. Then I want to check, for example, for drug monographs. I want to check what are the drugs related to the coronavirus. As you can see here, all the drugs related to the coronavirus will be listed here. If I want to check, for example, any of those, so let's check any of those. Here's the molecular name with the trade name, and then a description, mechanism of action, pharmacokinetics, and then indication and dosage, the administration itself, monitoring parameters, contraindications, interactions, adverse reactions, classifications, and references. And also, if I want to check for the name, for the trade name in different countries, I can scroll down to the bottom of the page from global drug names. You'll find here, for example, the same medicine in Argentina is its trade name is Briotaz, and manufacturing company is called Bago, for example. So whatever I'm looking for related to a medicine or a drug, you can just select, search, or type your search here for the medicine, and it will show you all what's related in the drug monograph related to this medicine of your interest. Top of page, back to results. Then I want to check, for example, further about the patient education. So what should I find here in the patient education? I selected patient education from a filter by source type for the coronavirus. Here are the patient educations related to the COVID-19, frequently asked questions, managing your common cold, severe acute respiratory syndrome, patient education for the COVID-19, pregnancy. So let's, for example, check the one for pregnancy and COVID-19. I'm gonna print it in English. So I selected English. And if I want to add any special instructions for my patient, it will be printed in the first page because it's downloaded as a PDF. So you have the chance to modify anything, and it will be listed on the first page. For example, special instructions or the name of the institution that you're working within. If you want to add your contact information, if you want to change the text size, it's optional, up to you. Then afterwards, I'm gonna create printable PDF. Here it is, patient education for pregnancy and COVID-19, Elsevier point of care 2020. A description, how did this affect me? How did this affect my baby? What can I do to lower my risk? Follow these instructions. Where to find more information? Questions to ask your healthcare team. Contact the healthcare provider in case of, get help right away, and the summary itself of the patient education handout. So as we mentioned previously, these are non-medical terms that you can give to your patient to understand more about his or her disease, if we're talking about the coronavirus. And of course, on Clinical Key, you'll find more than 17,000 handouts related to different diseases. And you can print any of those as long as you're a subscriber to Clinical Key. So let's go back to our search results. Anytime I want to recheck the resource center from the home page, I'll scroll down to the home page, and then I'll find the resource center. Select the country, International Resource Center, but I want to select the country I'm within, Middle East and Africa. It will automatically open the resource center for Middle East and Africa. So if I want to check, for example, a webinar on how to use Clinical Key for the COVID-19 to get the latest evidence-based information, and if I want to show you how to check all the open access resource centers, there's a video to show you how to reach all of these open access content. Then there's another video on how, if you're still new to Clinical Key, and welcome you to Clinical Key. And then there's a specific video. So for example, if I want to find a disease and condition summary, there's a video for that, how to save, how to search, how to use the presentation maker, because you can download the images with its reference and copyright on Clinical Key. how to activate the remote access, and if you activate the remote access, you can download an application to use it later on your device or mobile. How to register. If you're still new to Clinical Key and you didn't register yet, you can register on Clinical Key using your institutional email. So this is a summary of all what you can find related to the Healthcare Hub, with all the clinical solutions, content available for the COVID-19 for being open access, and you can share them and download them. And if you're a subscriber to Clinical Key, you can use Clinical Key in the same manner as I just showed you to search for the latest articles available for the COVID-19. Thank you so much. I'm looking forward for all of your questions.
Thanks to you, Sharif. We are open up for your questions, everyone. If you do have any questions, please please do share your questions with us.
There is a question here, Khaled, in the chat. Will the recording be provided to the attendees?
So the webinar is being streamed live on Facebook as we're speaking. It should be also uploaded to YouTube, our YouTube channel, Elsevier Africa, within few days. So there are questions about the links and how the presentation and how you will get those. At the very end of our presentation, I'll be sharing with you how to get access to those resources and all the links that you would need, all the links that are joined. We are also happy to welcome with us Dr. Muhammad Tanamli. He is Dr. Muhammad. He's joining us as a panelist as well to handle your questions. He is our clinical solutions manager for Africa. Dr. Muhammad would.
Thank you, Khaled. Thank you, Sharif, for a wonderful presentation. I believe it's enriched the experience for all attendees, and part of it actually even for myself. Being an Elsevier person doesn't mean that I know everything, and I sure learned a thing or two from your presentation today. I'm here available for everyone. I hope that some of the people here have at least received my invitation over email, and we're all here for all your questions. I'm looking at the list of attendance. Immaculate, hello, how are you? Mrs. Mbeda from Kenya, thank you as well for attending. And see a few people that I personally invited. It's a pleasure to see you all here. Please feel free to type in your questions on the chat, or for those who have my direct contact, I'm more than happy to receive your questions as well.
So that, thank you, Dr. Muhammad. As a method to move forward, while you type in your questions and answers, I'd like to move a bit ahead with some of concluding slides that we have as well. So please submit your questions on the Q&A. We are trying to get to all the questions that you are sending in right now. There is a series of podcasts that are done with I would say very expert professionals in their specific fields, that these cover very specific topics. So our first episode was on the transmissibility, pathophysiology, and treatment of the virus. It was a podcast with Dr. Stanley Perlman, who's a professor of microbiology and immunology at the University of Iowa Hospitals and Clinics. She is a very expert virologist, specializing in coronaviruses, in the entire family of coronaviruses, and she's been doing it for quite a while now. Episode 2 was on COVID-19 and emergency preparedness. We had Dr. Daniel Nadwerny, who's the Director of Emergency and Patient Care Service in Massachusetts in USA. The third episode was on medical informatics. So there is one very important part because there is a huge boom in the kind of data that we are having over COVID-19. This is why we are turning into informatics specialists and data scientists. And this was focused on the role and the utility of hospital digital resources and telemedicine. As my colleague Dr. Amsi said a bit earlier, telemedicine is becoming a very growing trend when it comes to how to handle patients who will be also afraid to go to the doctor. Everybody's afraid of an infection. Even the healthcare professionals are sadly, we are losing a lot of healthcare professionals to the infection itself. So this is one other interesting webinar podcast that I would strongly advise you to go for. Before we go to the links, also one last thing. So we have some very expert solutions in different fields. If you are a researcher working on a coronavirus related research and there is one of Elsevier's solutions that you would need personal access to, you can get free access through the Coronavirus Research Hub. This is on very individual basis. If you are working in life sciences or development of drugs especially, or if you are a data scientist, you can actually get the resources that you would need for drug development, for example, for free for academic researchers and governmental researchers as well. You can also please follow our Facebook page, Elsevier Africa, and to keep up to date with our latest webinars and our latest research as well. And you can also stay connected with the Facebook group. So one main difference between the Facebook page and Facebook group is that a Facebook group leaves more room for actual interaction. So please feel free, and we can join in discussions together on this Facebook group as well. The webinar is being broadcast live on both. Do we have, Dr. Sharif and Dr. Muhammad, do we have any questions that you would need to follow up on? Have we received other questions?
We're still answering the questions while you're...
Yes, Sharif is answering them live on the chat. There was a question from, I believe, Dr. I'm having trouble reading the name. How can we get the latest solution or vaccine or research on COVID-19 healthcare?
Mm-hmm.
Yes, Sharif, would you like to take this one?
Sure. So Dr. Joshua, I think the name is, I hope I'm pronouncing it right. So for the latest content available, you'll find all what you're looking for on the Information Center, Coronavirus Information Center. We shared the link actually, and everyone can download the presentation at the end with a certificate of attendance, and you can check this link for the Information Corona Center, Coronavirus Information Center, and you'll find a lot of useful content available for your inquiries. And also, if you're a subscriber to any of Elsevier solutions, if you typed your search word related to the vaccines research on COVID-19, you'll find a lot of content available relevant to your search.
Let me put it on screen now, because we've spoken a lot about the Information Center.
Okay.
Yeah, so this is the Information Center. So this is built as a continuously updated landing page to keep up with what's new, what's going on. Whether it's clinical information, it's research or drug discovery, what's new on the drugs, on the drug development, public health or patient resources. And we said that we've built a Chinese language portal because this is where it all started. By the time we established this page, it was mainly confined in China. So as you go forward, so these are some director who's actually curating and leading the team who's continuously updating this. some of the solutions you need. The podcasts I just overviewed with you. And you can see here, you can start to see different resources available, different webinars coming up, whether they're recorded or not. Someone was asking on the mental health. So we are actually in the healthcare hub explained by Sharif. He actually had, there is a portal for just the mental health aspects of the current pandemic. One interesting resource as well is the anxiety screening tool. It's created by Elsevier team of experts. So it's designed for individuals age 13 or older to be it has some resources for the clinicians as well as the patients and public as well. Patient education on living with anxiety or managing stress, and we have them on videos and on depression. And so it's recently, so everybody, so ever since the last months or so, there has been a boom as well in terms of everybody's having more concerns now regarding the mental health aspects of the current pandemic as well. As you go forward, there are a lot of resources. These are built up continuously. So if there's something new, it comes up on top. And as you go forward, you can discover a huge load of resources that are available as well. So that's one thing. If you want things organized into what you would be looking for, so I'll be going to Else COVID Hub, directory, and it's organized by who you are. So if you're an academic researcher, these are the links you'd be looking for. If you're a healthcare educator or students, these are the links. The healthcare providers, this takes us to the healthcare hub that was presented a bit earlier by Sharif.
Yes, can you please share also the mental part, Khaled, if you're opening the tab? Yes. Here's the mental health on the top right side, or you can scroll down until you find it. It's fine. It's up to you.
Yep.
Scroll down a bit. Yes,
yeah, if we scroll down, so there is the mental and behavioral health. If I explore this, these are all the resources. This was actually newly found. This is,
yes.
I think this might be one of the very new sections that we've added recently to this.
True, that's true.
Resource center, yeah. So and also if you're a librarian, these are resources for librarians and campuses working under COVID-19 media. And someone was asking about the engineering aspects. We actually have a landing page for engineers. So engineering resource for the COVID-19, the resource response. So some aspects are related to all different kinds of engineering, whether it's developing new devices or working with the current or upgrading the current technologies, or there are engineering aspects related to COVID-19 as well, and all of that. So there is actually a landing page if you are an engineer for the COVID-19 and the resources that you would need as well. One other thing is, so I told you about the directory for requesting, the individual access. So this can help you request individual access as well. All of these links are available and are shared with you. I'll let you know all of them are available when. So this is temporary access to 28th of October on individual basis, only if you are working on something directly related to COVID-19 and you are part of an academic, if you are an academic or a government researcher. Did we get most of the questions that for now, or am I missing anything?
I think we did. Let me double check here. The one related to the psychological science and mental health. Yes, we did this one. We did the one for the engineering. I think that's all.